Well, good morning, everyone, and welcome to the Wake Up with Wellness. This is the last session of the series, Digging Deeper, the Impact the Pandemic has had on education, grocery, and healthcare. My name is Mary Cruzy, and I'm the CEO of Health Source Solutions and your facilitator for this morning. We started Wake Up with Wellness to bring together passionate leaders who want to grow and challenge the status quo of worksite well-being. So our mission is really to connect and grow well-being advocates, and leaders, and pull us all together to really kind of lift up well-being and resiliency in organizations. I am so pleased to have Mr. Mark Funderburk with us this morning from UMC Health System, and that is located in Lubbock, Texas. So we are expanding our reach for sure, and they're going to share the great work that they've done around well-being and resiliency. So, as I step back again, these quick decisions and ever-changing pace of the pandemic, it really tugged at our emotional well-being, physical well-being, mental well-being, and we're really feeling the aftermath of that. Just this morning, Mark and I were talking about the burnout and how it's continuing to almost become more of an issue than it has been in the past. So those are certainly things that as well-being professionals, we need to kind of address. And in recognition of these frontline workers that have really not had that choice, especially in healthcare, we are going to recognize the phenomenal work that they have done in pushing through this tough time. And we have donated 100% of the registration fees for these sessions, all sessions, and they're going to be donated to the Frontline Families Fund. And what this fund is, it's a financial support for educational scholarships to those families of healthcare workers who lost their lives to COVID-19. So we're thrilled to be able to help support and lift up these people that literally put their lives on hold for us. Just two housekeeping items before I kick everything off, and that is one, we will be fielding questions, so please use the chat feature to ask those questions, put it in throughout, and we'll break during the time to answer those. And the second thing is we will be having some breakout sessions. And so as you attend those sessions, please think of questions that come out of that or even suggestions you want to share with everyone and put that into the chat feature as well. So let's get this rolling. Gives me great pleasure to introduce to you Mark Funderburk, the President and CEO of UMC Health System. Mark has been with UMC for 29 years. He began his education at Texas Tech, where he did his postgraduate fellowship, and then progressed to the department director, chief operating officer, executive vice president, up into the taking the helm, which he's at right now. During his tenure at UMC, Mark has served at the helm of this cultural transformation of the organization, which they've termed as service is our passion. And it's capturing national rankings for employee and patient engagement, as well as market growth in Lubbock and in the vast region of West Texas and even Eastern New Mexico. Mark holds a BS in health information management, sorry about that, I turned my tongue back around, and an MBA from Texas Tech University. And he credits his faith, family, and UMC leadership for his accomplishments at UMC. And I just want to paint a little bit of a picture before I turn this over to Mark. UMC is a 500-bed hospital system. They're a primary partner to Texas Tech Health Services Center located in Lubbock. They have 800 medical staff and 500 employees and encompass 60 sites of care across the region. And I did learn pretty fast when I first visited Lubbock, Texas, that the word Texas Longhorns is pretty close to a cuss word when you're in Red Raiders territory. And so this morning, Mark, let's just start out by kind of painting that picture of, the world turned upside down, what felt like a day. If you could paint a picture of what UMC and how you reacted.
All right, I'd be happy to. So thank you so much for your attention today. I appreciate the privilege of sharing with you our journey. It's been quite a ride in the last year. I do want to take you back just a little bit this morning, a few years, and then discuss the pandemic, just to set the context of kind of where we are and what replenishment and wellness really has meant to us in the past. In 2002, frankly, our turnover of employees was 40%, which is abysmal in healthcare. Our patient satisfaction was at the 50th percentile, which is clearly average. And our employee satisfaction was not even measured. UMC was, in every stretch of the word, a county facility. You went to UMC if you didn't have many choices at your disposal. And so it's really important that I be very transparent up front and kind of eat crow up front and kind of tell you exactly where we have been in our past. Today, we are very blessed. We are in the top 10% nationally for both patient and employee satisfaction for several years. And so that really does set the tone for what we're able to do through the pandemic. So you fast forward now to 2016. Replenishment and wellness were fairly new words to us at that time. It was in 2016 that, in looking at the data, I realized that millennials, as an example, they occupied 50% of our staff, but they accounted for 2/3 of turnover, and they were leaving within 5 years. And so we hired a consultant and we undertook a comprehensive study of our workforce, and we asked a lot of questions. We asked 2 questions in particular. Number 1, what keeps you here at UMC? And number 2, what makes you want to leave UMC? And we have over 5,000 employees, and so we asked a lot of people about those 2 questions. Well, when it came to what keeps you at UMC, they said it was really simple. Making a difference, of course, that's healthcare, pride of work, meaningful work, and acknowledgement of good work. When it came to why I want to leave UMC, we were shocked and disappointed because what they said was lack of respect. And one of the phrases that came out quite a bit from our staff was, "You don't have my back. As my boss, as my supervisor, as my mentor, I don't feel like you have my back." And gossip is pretty prevalent in our organization. And thirdly, the culture is very strong for patients, but it's not very strong inwardly to support the employees. So out of this whole wake-up call, we began to learn what replenishment and wellness and respect should look like in a healthcare organization. We asked a group of employees, frontline staff, if you could create your definition of respect, what would it look like? And we just kind of let them go off and meet, and they came back with this, which I like very much. They said, respect is a conscious effort to trust and listen and be accountable, and to value the person, and here's the important part, behind the badge. Behind the badge became a mantra a few years ago, looking past the credentials to respect the person. Now, you know, healthcare, we are knee deep in credentials. Everybody loves credentials. The more letters behind your name, the more qualified you are, et cetera. And so to look past all of that, whether you're a housekeeper or a pharmacist or a respiratory therapist, and respect the person was a tall order for us. We implemented also something called Manage Up. Now, as a leader in the organization, I have required all leaders, about 300 of them, to write at least 2 thank you notes a week for years to express gratitude for good work in the organization. And we measure that, and et cetera. But I really needed a grassroots effort to manage up people across the board. And what I mean by manage up is, that just means you're telling somebody else's boss and them that their work is appreciated, and you're describing why it's appreciated. And so to me, managing up makes teamwork visible, and it makes it accounted thing. It makes it accountable thing. In 2017, we had around 1,200 manage up submissions, which was a nice start. In 2020, during COVID, we had 24,700 manage up submissions. So it has skyrocketed as people have tried to look for something to be grateful for and to acknowledge good work. Our chaplains, our chaplains have been historically, their work happens in the patient room. You are counseling, praying, consoling, comforting folks in difficult days. I asked them, I said, I need you to cast a different vision. Keep doing what you're doing, but I need you to cast a vision for replenishment of staff. Help us to stem a growing tide of staff burnout. And so they started a replenishment series, and it's offered all hours of the day. And it's essentially, you give a book to somebody, they come to a class, some are virtual, some are not, and you're teaching them how to be replenished within a spiritual context. It's not preachy, but it is a spiritual context. You're trying to give somebody that amount of fortitude, so to speak, for the job. Wellness is really what you might expect. Physical wellness, financial incentives, reimbursement for gym memberships, that kind of thing. All that was rocking along fairly well. It's astounding how many people are stressed and need to be replenished over financial health. So we had something kind of like a Dave Ramsey course where you are trying to help folks get over financial debt stress and to live with it. The last one was physical stress, and we heard year over year. I work at the hospital. We're open 24/7. I work at night, for instance, and my dinner is not at 6 p.m. My dinner is at 1 in the morning. And so I need to be replenished. So we opened about 18 months ago our first replenishment lounge, which is simply a kind of a small room, and employees use their badge to go in the room, and they can have fresh fruits and snacks, and you just pay for it on a little badge and walk out. And it's open 24/7, and it's for everybody, but it was built for people at night who feel alone, who have limited options, and they need to have a place to go. Now, having said all that, we continued to build replenishment and wellness into our operations, and then it happened. March 17, 2020, we had our first COVID inpatient, and everything for us changed at that moment. I want to show you a video this morning.
China says the number of people infected by a mysterious respiratory virus has more than tripled over the weekend.
We have a new name for the coronavirus. The World Health Organization has officially called it COVID-19.
Health ministers are urging residents to stay indoors and by all means avoid faces.
There are new suspected cases in California, Oregon, and Washington.
What we know now is that the virus is here, present at some level.
This is truly an unprecedented situation.
The hospitals are cracking with conditions deteriorating by the day.
Are we gonna have enough rooms? Are we gonna have enough beds? I don't know. I don't know what we're gonna do.
We are exhausted. We are tired. We are near burnout, if not already burned out.
During the trying times that we're having right now, it's important to restore hope. Because to have hope means to keep fighting.
The way I've seen the UMC culture shine during this crisis is because every department has stepped up and shown support to one another.
A celebration of recovery after 40 days in the hospital.
Yeah, he was in really good hands. I think the best care I've ever seen in my life.
I pray for all the medical staff, the people that are in there taking care of them. You know, when there's no one that can be there for them, they are.
I was there for the second prayer event. That was so powerful to know all of those people were there for us. And not just for those of us patients, but the people that were helping us survive. Service is our passion. Man, I got to see that. I got to see that firsthand over and over and over again.
This is what makes UMC unique, our trust for one another.
So at our peak, we had 196 COVID inpatients across 6 different units. We had 211 employees that were out sick with COVID or quarantined. To date, we have lost 6 of our own employees to death due to COVID. I'll tell you, our initial concerns last spring, let's just say go back to March, April, the initial concerns were about PPE, getting enough masks and supplies, getting enough testing supplies to test thousands of people, visitation restrictions, keeping people out of the organization. And then we gave up all those elective cases, and that's where you make your money. And so we had financial consequences. So as COVID kind of settled in around June, July, August, and became kind of the new norm, we began to absorb and to realize the heavier cost of the pandemic, the impact upon our staff. Burnout, I've heard that word before, but burnout gave way to weariness, and that gave way to a new type of fatigue, I would call it, which, to be honest with you, was articulated by our staff when they said something like this: "You don't understand what we're going through. You can't, you won't, you just can't." And they were fairly right on that. Now, this stemmed from our staff. They were worried about their own kids, their own health. But beyond that, what people don't realize a great deal, and it's just the way things were, we have staff who are dealing with 3 times the normal number of deaths. And that was hitting especially hard those units that are COVID units, where families of dying patients had limited access to even see those dying patients. And so that is the kind of fatigue I'm talking about. Lots of death, well beyond what we're accustomed to seeing. So with that being said, I want to show you something. I have a graph here I want to show you, and I'm calling it the COVID comeback graph. And essentially, it's something that I want to kind of walk you through this morning. What you see here is a visual of how we have orchestrated a new level of replenishment through the dark days of 2020. Now, this is a depiction of emotional manifestations following a disaster. And when I say a disaster, I mean what you typically think of as a disaster: a hurricane, a mass shooting, etc., something that really takes down a community. We found this application and we applied it or adapted it to COVID. And I'll tell you, this was spot on, by the way. So on the left-hand side, early on, there was a period of much civic pride and heroism and cooperation. There was lots of gratitude. And over the course of time, that gave way, as you would expect, to disillusionment and frustration because resources were stretched and staff were essentially unable to travel. Many of them did not go home at night. They found other places that we provided for them to live. And then as you went on forward, the vaccine signaled recovery, which was around December. And then the anniversary a few weeks ago ushered in a time to grieve before moving on. Now, at the end of this, you hope you come out of this stronger than where you began. So we call this our COVID comeback graph. In fact, we just celebrated our 1-year anniversary a few weeks ago. Now, the next graph is exactly the same thing, but to operationalize this, you can see in green all the actions, all the activities, all the efforts, some small, some large. These are all the things we did through the pandemic aimed essentially at emotional and spiritual and financial well-being of our staff. There's too much to read on here. It's just a visual of all the efforts that our COVID committees worked on. Now, I'll tell you, I think our high point in the whole event the whole pandemic was our community park and pray events that we held in our parking lots. You saw a picture of those in the video a little bit. And then at the beginning of COVID, when the schools were shut down, we set up a free daycare for our employees for the remainder of the school year. I had 170 kids out there, and I had quite a few nurses who were redeployed to work out there because we shut down elective surgeries. So childcare was an enormous help to them and their well-being. Our chaplains began sending out messages of encouragement and support on a very regular basis. You know, how do you deal with stress? How do you deal with loneliness, et cetera? And then we developed up front a financial rescue plan for all those folks who were afraid of being let go. We didn't furlough anybody, gratefully, thank God. But we were allowed to let them know we're going to retain their jobs. We found other places for them to work, temperature checkers and working in the clinics and all the different places we did. And then toward the very end, we also held a hero walk in honor of those that we lost. Beyond this list of or litany of information, we also have a wellness portal, and we implemented a lot of strategies and challenges focused on resiliency, and these were very well received. Utilization doubled compared to prior offerings in our portal. And then we can remove the graph there, thank you. Lastly, we implemented something I think very important, and this has kind of got a lot of weight to it. We implemented a peer support team. Now, this is not just regular employee assistance through HR. The peer support team was formed to help with compassion fatigue and high stress situations, traumatic events like multiple deaths on a unit, interventions needed all across the health system. The team is made up of employees who are specifically trained in critical incident stress management, like EMS, chaplains, nurses, mental health professionals. And they come together when an event happens and when they're called upon, and they kind of rally the troops to do that. So in conclusion, I can tell you honestly now that I know that replenishment and wellness are now fully valid resources. If I didn't believe it 100% back then, I certainly believe it now. They cannot be oversold. COVID is not eradicated, of course. We still have a few patients. But beyond the pandemic, we have definitely seen the absolute need for a continued heightened focus on replenishment. I'll close with this, and this is really good news, and I'm just pleased about it. Every February, we assess our patient satisfaction, and we measure it, and we compare ourselves to 1.8 million healthcare workers across the country, so it's the biggest database. And I was a little worried. I was a little worried because we had just come out of COVID, and it was February of this year, and I just didn't quite know, frankly, where we stood to a great degree. But we did come out at the 93rd percentile, so we're still in the top 10%. And I'm just terribly, terribly grateful because, again, you just don't know when somebody tells you, you don't understand what we're going through. And clearly, I did not fully. I was not quite sure how we'd come out, so I'm grateful for that. So that would conclude my presentation. I'd be happy to visit more or answer questions.
Wow. Well, thank you, Mark, and what a journey you have been through. And the comments I saw, you know, goosebumps. Wow, how powerful was this? This is amazing. I got chills from this. That just tells me just the emotional impact that you have made, even on the people on this call right now, to share that journey with us. You know, I do know Dean, who is our direct connection at UMC, had shared with us how important it was for you to make sure you stayed connected to staff. And you sent out daily emails to the staff. And I just wanted you to share a little bit more about, you know, I mean, you were managing a lot. You know, what was it coming from you that kind of empowered you to want to continue to make this connection?
Well, I'll tell you, I thought I was making a connection beforehand. I really did, but clearly I was not like I should have. And through this ordeal, the changes were happening so rapidly. April, May, you are kicking off so many changes and directions about every nuance of how patients are treated here or families. And so I felt very passionate about, because I needed to find a way to encourage and to stay in touch and to show gratitude. And you can't be everywhere at one time, and you can't put on the same suits they're on and go in the rooms. And so reaching out to people every night, which I did last night, we're still doing it, at about 9 or 9:30, it just gave them a chance to know that someone is listening, someone's in charge. The decisions that we're making are not random decisions. They're based on science, or the governor's discussion with us, or the mayor's, or et cetera, or just our desire to be supportive of our staff. So we did it mainly just to stay in touch and to show gratitude.
And wow, I think about, we support a program here called Good Leadership. And one of the things in Good Leadership is this whole piece of gratitude. And, we need to help reward excellence. We need to say thank you. We need to help spread that positivity, because that's what powerful and good leaders are. And so you exemplify obviously what a great leader is in taking care of their team. And certainly your statistics, just from what you shared with the change, and 93% of employee satisfaction during one of probably the country's lowest times, is just, kudos all around. As my children do.
There you go. Well, thank you.
I would like to step up. One of the things as we work with leaders of organizations in this kind of well-being resiliency state is the constant question: how do we get leadership involved? How do we get leadership to embrace this concept that if we don't take care of our employees, we're losing the nucleus of who we are? And it doesn't matter what organization you are, right? You can be manufacturing widgets, or obviously a healthcare system, or in teaching. So can you share with me, like, as a leader, how to help what I'm going to call people passionate about wellness get their leadership on board with this?
Okay. A couple of things I can think of, pardon me. One is, and this is what I think this will resonate with, if I can use the term, the C-suite or whatever. Yep. Before you can cast a vision, or say we're all in this together, or hang some standards on the wall, or some values, which everybody has, I think it's very, very important to choose, and this is what you can convince somebody of: choose your measure. What are you going to measure? How are you going to define success in replenishment or wellness, or whatever the case is? How are you going to define it? For us, the measure is very clear. It's turnover and employee satisfaction. Turnover and employee satisfaction, both of those together. Those, they provide the data, and we have a pathway to improvement. And the truth of the matter is, and this is where I think C-suite might appreciate this, if a leader cannot make the improvement in turnover and employee sat, that does not mean they are flawed or unsuccessful employees, but it does mean they can't be a leader for me. And so when you talk to leaders about what's the value of this, introduce a measure, let the measure be your guiding principle. And when people don't measure up, after they've been coached and after they've been helped and after they've been educated, then you have to make the decision. That doesn't mean they're bad people. That simply means they can't be a leader here. And then you move on. And then that's what really, if you think about the old book, Good to Great, my favorite book, that's what starts the flywheel moving. That's what starts momentum. But it took us years, took a decade to do this. But nonetheless, that's what I would say. You have to have a measure to start.
Phenomenal. Well, this is a perfect spot for us to maybe transition into some breakout groups about, and I had another question for y'all, but I think I'm going to stick with this whole thing about what's the question? How are you going to define what your success is? So as Jenna puts us in the breakout groups, I'd have you think about that and share with each other, how do you define success? And I'm going to challenge you to think past what Mark just shared with us, because he already gave you that answer. So think about other things that companies can do to define that success. And we got about 5 minutes. Well, welcome back, everyone. Thank you for this time. So our group happened to actually launch me into a great, one of the questions that I had for you, Mark, and when they talked about how do you define success, we actually do ask that question to our clients as well. And one of the things that one of the participants shared is how they felt like the conversation has, in the last 10 years, has shifted from kind of this ROI mentality of wellness to more of a VOI. So the return on investment, the dollars attached to it, to more that value on investment. And this is something that I feel especially leaders that are young or have never done a wellness or health promotion type of program in their organization, you know, they focus in on the dollars. And it's sometimes hard to get them to start to shift to think about, it's hard to measure dollars in a wellness program. So can you just give us any insight, like you would share with a colleague, another CEO of a different organization, of why you guys have really kind of shifted that to more that VOI mentality?
Okay. I think, yeah, the first thing I'm going to say is this is what I say to new employee orientation every month. So every month we have around 50 to 60 new employees. And so, and we're, you know, we have clinics, et cetera. So we're kind of growing. And so what I tell them is this, talent always has a choice. Talented people can work where they want. Now, this is especially true in healthcare or elsewhere. And I've got to remember that constantly. People can go anywhere they want to work. A nurse, a therapist, a pharmacist, a physician, a good housekeeper, which is singularly the hardest position to place right now in Lubbock, Texas. I'm down by 30 positions in housekeeping because, of course, other different financial obligations, et cetera. And so talent always has a choice. And if you're hiring for talent to fit a culture, you're being kind of picky. And the fact that they can work somewhere else and you've got open positions means your eyes should be open to wellness. Wellness is a piece of keeping people engaged. Now, it may not have been as much a piece for people of my age group, but I'm not 54% of the population. Millennials are 54, and then I've got even, you know, beyond that. And so I've got to think differently. Replenishment has to be a part of keeping talent here. Now, that's the overall statement. Talent has a choice, and I want the choice to be here, but good luck with that if I'm not offering something about wellness. The cost, even if you just look at the cost in general terms, the cost of an RN or a pharmacist is generally 75 to 150% of their salary just to turn them over. Because you've got overtime and you've got training and you have weeks of orientation. And so if it's going to cost me 75 to 150% every time somebody leaves, I have got to have this as part of my arsenal to throw at the wall, so to speak, and see if it sticks. Wellness has to be a part of the arsenal. And I'll close with this, or this question. We were discussing this a moment ago. I don't have a remote work policy right now. I should have, but I didn't. And I've got people leaving right now in information technology constantly. And so we're developing a remote work policy to work from home indefinitely. But even that has got to have some measure of replenishment in it, because I don't know how long that's going to be productive. So even that we're not up to snuff on yet. We've got to chew through that this whole summer and bring replenishment into that piece of the workforce.
Absolutely. And thank you. You know, we've had conversations, I know you and I chatted this morning, but also just in general, this whole new era of wellness and well-being is how do we support our remote workforce? Because it is very different. There isn't that, you know, we hear Zoom fatigue, and that's how people want to connect. So it's kind of an oxymoron, okay, you're too tired to talk through Zoom, so how do we connect? And, it comes down to kind of, we're humans, and human nature is to want to rub shoulders, to want to feel like you belong to a group or something. And so I echo kind of obviously your concerns and issues with your IT people, but I think as this world moves into a new phase, I'm concerned. I read just yesterday about a survey done with tech companies, and the tech companies were asking, would you rather have to stay at home, work remote, or a $30,000 increase to your salary? It was like 70% of the people would rather work remote. And that just blew my mind. I'm thinking, so clearly, does money speak? Yes, and yeah, clearly in this situation, no, right? So I do think this is a new era for health and well-being. And as you said, talent has a choice. They can go where they want. And it's not for us to judge, is this talent making the right decision? Do you really want to work remote? Do you really want to become disconnected? So my hope and prayer is that it does swing back to the middle a little bit, that we're not all over here, that people realize this connection. Moving on to kind of another question. It's one of the things that impressed me, and I began working with UMC, I believe it was 8 years ago, and it was right out of the blocks, well-being was a part of your strategic values. You really felt that, and I'm sure this is the journey you were working through with your resiliency, is that you felt like, this needs to be part of our strategic goals. It can't just be a benefit per se. Can you share with us a little bit more about the passion and why it's so important companies make that connection?
Well,
sorry.
When I think about the folks that are making, let's put it this way, Lubbock, for instance, is not Dallas, it's not Fort Worth, it's not Austin, it's not the coolest place to live. I love it, but it's not the coolest place. And so you've got all these things kind of working perhaps against you in your community, or people making choices out of college or whatever to come here. And so there are several reasons why people might not choose you. But if you're adding up the reasons why they might, work-life balance was not a term I knew when I first started at UMC. I never heard the word work-life balance. I just thought that meant you work till you're retired and then you have balance. That's the way. That's my definition of work-life balance. Well, that doesn't fly. I know that. My son, who's 28, tells me that all the time. And so work-life balance is a new term to me, and it means I've got to think balance all the time. I got to be thinking balance. What are we going to do? Because all those things you saw in green on that graph, now I'm trying to decide how many of those continue. Okay, COVID, I don't have 189 patients. Last night I had 11. I don't have 211 patients out sick. I have 2. Thank God, I only have 2. So as we move forward, how much of balance am I going to push forward? Because the truth of the matter is, we've all gone through COVID. The expectation is different. They're looking at their employer differently. I want work-life balance. I want you to care for me in a way that I was not aware of I even needed perhaps in 2019. So I think we are being pushed, prodded, compelled to make replenishment and wellness part of the narrative now. Not just a program, not just, oh, we're doing a picnic, or we're having a new, assessment of your health, et cetera. No, not really. It's going to have to be, how do we feel about this decision we're making regarding wellness, et cetera? How does that look to the employees? Because they're going to be talking about it as they make choices. So I think COVID has kind of taught us a lesson. And if I think I can rest on my laurels now because, hey, it's over, all that stuff you saw in green, I think is going to have to be pondered as we move forward, I believe.
Absolutely. Well, I'm going to use, again, this is a launch point for us to go into one last breakout group here. And, leaping off of what Mr. Funderburk just stated and the UM strategic goals, this is one of the pillars, or one of the goals within their pillars is what I'm trying to say, and not getting out very efficiently. To share ways that organizations and your organization or those you work with has or has not taken the time to align this to become, as you said, part of the narrative, which I think is phenomenal. So again, if we can break out into groups, we have 5 minutes and we'll come on back. Well, welcome back, everyone. As I kind of move forth from that piece of information, I also want to make sure people didn't feel guilty about if your leadership isn't and hasn't tied it to your strategy yet. We all have to start somewhere. And as Mark said, it's been a 10-year journey for UMC. It's not something that ever would happen overnight because it takes time, and it should be a journey with no endpoint, right? One of the last things, and I'm going to maybe pitch a toss at you here from a little bit of a left field, but as leaders in an organization, you know, people look to us to continue to be that power of influence and positivity and generosity and lifting ourselves up and kind of keeping the yay rah rah moving forward. So what do you do, Mark, to kind of take care of your health and resiliency and well-being? Like I said, I'll put you on the spot.
Okay. Yes. So I spend time with my family. I do work every night. That's beside the point. I spend time with my family. I spend time in my church. I teach a class in my church. I spend time with my faith. And even though I'm not at work, I enjoy learning how to be a better leader because all of us have room to improve. I certainly do. And so I do read quite a bit, which kind of engages me. There's no pressure to it. You do it at your own leisure. And so I read quite a bit about that. And that seems to kind of give me encouragement. I'd like to say that I'm playing tons of golf and that kind of thing. No, not so much. I'm a little bit of a workaholic, so I'll beg forgiveness for that. But generally, it's my family. It's my faith, and I just enjoy learning how to do it better, essentially.
Awesome. Yeah.
That's not a very fancy answer, but that's
you know what? It doesn't have to be a fancy answer. I mean, we all have different things that refuel our tank, and I think that's what's really important is, and this goes to each person out in our audience today too, is we need to take time to refuel our own tanks as we lift up and empower others to do that. And sometimes it falls on the shoulders of, you know, aren't you perfect because you know you're a wellness person? And we're not. In what fuels each of us is differently. I have found, since I threw you under the bus, I should take that myself, right? You know, one of the things that really helps me, and this is really kind of around the anxiety and stress, is I have the fortunate that I live fairly close to work. I live about 3 miles from where I come to work each day. And I have, since spring, I walk to work, either walk or bike to work. And what I have really found with that is it's kind of a moving meditation for me. I'm able to kind of ground myself, to think about things. I do actually meditate on the way as I go. You know, you hear the birds and the frogs and a stick snap, you know, that you wouldn't hear when you typically, oh, let's get this up, you know, let's get a workout done. So I feel like I kind of am killing 2 birds with 1 stone with that piece of my day that is, I found, just to really enjoy and lift me up. Because it is, we each have to find our own niche. So I'm going to toss that ball out to the group out there as well, is what is your niche or pick me up to keep refueling our tanks? Well, I want to say thank you, Mark, as we come to an end here. This hour goes quickly. The journey that UMC has been on has been phenomenal, and congratulations to you and your organization for taking a 50% turnover rate and turning it into, you know, way less, being at the top 10% of the country in healthcare as a healthcare organization. having kind of grown up in a healthcare organization here in Minneapolis with Park Nicollet Health Systems, I know what a huge deal it is to make those rankings. I mean, it takes a lot of work, it takes persistence, it takes great leadership. So my congratulations to you and UMC for what you've accomplished over the last 10 years.
Well, thank you very much. It's been a pleasure. Thanks so much for this opportunity today.
Well, thank you. And thanks for attending, everyone. Again, we appreciate it. The next conference that HealthSource will be supporting, we're moving out of our Wake Up with Wellness series into the Midwest Health Promotion Conference, which will be on October 13th of 2021. So please put that date on your calendars, and we would love to see you. We are going to hopefully be in person again, with the option of a virtual event as well, potentially. So kudos to everyone. You have a wonderful weekend, and thanks for coming.
Thank you.